pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we're waiting for a doctor from Centric here, so Dave, if you want to go ahead with the public input, go ahead.
All right, we'll make this quick, but Mayor, members of the council, I appreciate the opportunity to just take a moment to recognize staff from Great River Federal Credit Union. They were very generous to us, our agency, towards the end of last year, donating over $3,500 to allow us to purchase 2 body cameras that we desperately needed. And so I have with us tonight Jill Voigt is the branch manager. Shelley is a chief retail officer for the credit union, and then Sarah is a marketing specialist for the credit union. So again, we just want to recognize and thank Great River for their support to our agency. So thank you very much.
Thank you very much.
Thank you.
Thank you. Perfect timing, Dave. I think we have Dr. Math on now, so.
Dr. Math, are you able to hear me okay?
Uh-oh.
We can't hear you. Or we can't see you.
There we go.
All right. We can see you now, but we can't hear you.
Still can't hear you.
No. I apologize. I'm just looking to see if there's anything on my end. Do you want to try to log out and log back in? Sometimes that might work. Now, Dave said that he can hear him, but we can't hear him. So why is that? Same as system. I'm not sure why I can't hear him, but we'll try this and see.
I think he's logged off now.
Yeah, he just got back in, so he's coming back in. We'll see if this works. I'm not sure. I don't have to do anything downstairs other than what I'm doing here, so I'm not exactly sure. We've had people before, but
What about that chat button up in the top left-hand corner?
the chat is what I have up on the screen right here. That gives me the opportunity to talk to him that way, just in writing, but it doesn't give me anything. I'm gonna see. Share sound, maybe.
Oh, we can see you. Can you hear us, Doctor?
Can you hear us, Dr. Math?
You're on mute right now. Still can't hear you.
I apologize, Dr. Math. We're unable to hear. I'm just looking to see if there's any settings that I can do on my part. I know others can hear you, but we can't hear you in the council chambers for some reason. Let me try that. One moment. Well, or in the computer? How about this? It's not ideal, but I could do something here. See if he sees this. Um, It may be an easy button that I'm not aware of, but I'm not sure. Dr. Math, do you want to try to give me a call? I chatted a number, and we can try to do it the connection that way. Dr. Math.
So I can talk without the. Can you hear me?
Yes.
Yes. I will do my best in making this work.
Lost him again.
Now we can't hear you.
Can you hear me now?
Yes.
Okay, great. So let me introduce myself briefly. My name is Dr. Maat. I'm the head of infectious disease at Center Care. I know you got all those slides, but I'd like to, given that we have such difficulty communicating, make that a little easier. So what I'd like to introduce you to is the newest data we have from Center Care about COVID and what we think should be done.
Can I just ask you one thing? Can you just slow down just a slight little bit? We do have a few that have a little bit hard time hearing, so
No problem at all.
thank you.
I'll try the best I can. So what I'd like to do is not going over those slides. Those slides have been done by Dr. Morris, our incident commander. I have some newer data that just came hot off the press, so to speak, this morning from Center Care, and I would like to share that with you guys just to get an idea what kind of a problem we're seeing right now and what kind of issues we're having. So just bear with me for a second. So we currently, the last 24 hours, had 119 admissions for COVID. That is all Center Care, not just St. Cloud Hospital, but of course St. Cloud Hospital would bear the brunt of it. We have 97 regular beds filled with COVID patients. We have 22 ICU beds filled with COVID patients of those admissions that we had. We have 882 Center Care staff currently not working because they're off with COVID. And we have a 7-day positivity rate. Let me explain to you what that means. So positivity rate means of every people we test for COVID, they come with whatever complaints they have. We have a third of them positive. So everybody that gets tested for COVID, about a third of them, in fact, do have COVID. Omicron, as you may know, is the current viral mutant that we fight with. And that has a few new things. For example, Omicron gets probably spread even if you wear a mask that is cloth. That's why the CDC now is recommending using a surgical grade, a medical grade mask, the ones we use for surgeries or that's used in a medical facility. It spread much, much quicker than Delta. Unfortunately, it does in fact vaccinated people too, although they don't by far not get as sick as people that are not vaccinated. We are in a crisis mode that we cannot handle any more patients in a hospital. We have very difficult time finding any beds. We have an even more difficult time finding ICU care. That means sometimes people that should go to the ICU because they have, let's see, a cancer or heart attack won't find a bed. We have to stem this tide, and I don't see how we can do that other than being much more restrictive who we expose people to. I would like to make this an interactive session, so please ask me questions, and I try to ask as best as I can. Don't expect me to make any excuses for the sometimes a bit confusing information policy that the CDC has, but I will try to do my best as I can.
I know it was difficult to hear.
Right, and I have an echo too, so I know it's difficult. So I think what I'd like to do is you ask me questions and I try to answer them to the best I can. All I can say from our end, it has been dramatic what we're dealing currently with Omicron. We have a full hospital, we have no available beds, we have admission rates that we've never seen ever, even with Delta.
Maybe just to reiterate a few of the statistics, and I'm not sure, I didn't write them all down.
So we had, within the last 24 hours, 119 COVID admissions within Center Care, okay? The majority of those admissions, of course, would be at St. Cloud Hospital, but there are some at our outside facilities which, of course, take care of COVID patients as well, so Melrose, Long Prairie, etc. Of those 119 COVID admissions, the majority, 97, went to regular hospital beds, right? So beds that don't require intensive care. 22, nonetheless, did require intensive care beds. We have 882 staff or members of Center Care staff, and that includes everybody, nurses, physicians, support personnel out. We have a 70 positivity rate, meaning the people that get tested at different sites for COVID, out of those, over a third has positive for COVID. Okay, so we have numbers that we've never seen before, even with the prior surges we had.
Thank you for that, Dr. Math. Does anybody else in the audience or council members have any questions that you would like to ask, or if there's anything else that you would like him to repeat? If you could come up there, then I'll try to reiterate it for him, but just so that the rest of the audience can
We
hear.
have N95 mask in the shop, but is that like a medical mask? Is that the equivalent of that?
So, Dr. Math, the question is related to the masks, and I know I was part of the call earlier or later last week, and I know that the cloth masks are no longer being recommended to be worn by the CDC. And is it my understanding it's either the N95 masks or the medically approved masks? Is that correct? So like the disposable masks that you can purchase?
Yes, there's two types of masks, right? We have what we call medical grade mask, right? That's the standard mask, for example, you probably know from physician when they do surgery, okay? That's the medical grade mask, which you can purchase, you're exactly right. Versus a N95, which we only recommend for people who actually take care of COVID patients. So this is not for general use.
Yeah, N95 masks are not for general use. So what they recommend for the general public are more of the...
You can use the N95, but these are a lot cheaper and more and flexible.
Yeah, the N95 are fairly expensive and they're real hard to breathe to over hours and hours
Yeah.
of time.
These are better.
Yeah,
And they're called a medical mask.
yeah.
Okay.
Did you have any other questions?
Doctor, you see this peaking in the next 1 to 3 weeks, or What's your thoughts on that?
Dr.
I didn't hear. Yeah, can you
Dr.
repeat
Math,
that?
yeah, absolutely. Do you see, the question is when do you see this peak? Do you see where the most concern is as far as a timing standpoint, and do you think that this is going to improve in time if masks, I know that's one thing that CentraCare is calling for, is for more businesses and members of the community to be able to mask up. What do you see as far as the time frame or the time span?
Well, we're still at the rising at the rise, so we do not know where the peak is. If I would have to put a guesstimate, I would say the peak will be sometime in February. Okay, it's rising very, very quickly, and of course, the only time it will stop rising is when everybody got infected, and we have no more person who get infected. The problem we wanted to stop that or flatten the curve is not because we don't want to get it over as quick as possible, but the problem is it puts so much pressure on healthcare resources while it's still rising. So I give an example. If we have 119 COVID admissions, but we have of our hospitalists, which are the physicians that admit patients with COVID, if there are 5 out because they have COVID themselves, you can imagine what problem that creates. So again, Omicron will be over if everybody got infected and over the disease. Before that, it won't stop. And the only thing we can try to do is not so much stop the infection with Omicron. I think what we need to do is just trying to flatten the curve so that not as many people get infected at the same time, so we don't have to have that pressure on healthcare all at the same time. But it will get over, no question. It will pass, but the way we have to decide is how it will pass. Will it pass with basically completely destroying our healthcare that we have currently, or will it pass by less cases per day and may stretched out longer? That's hard to know. But it will not be over until everybody's infected. There's no question about that.
I have a quick question for you. Out of the 119 that were put into the hospital, how many of those people have been vaccinated, fully vaccinated, and how many of those people have not?
Dr. Math,
Okay.
did you hear his question?
Yes, I did. So of those 119, we just got them this morning. I cannot tell you how many got vaccinated, but I can tell you before, last week, the majority of patients, let me just define first what vaccinated and fully vaccinated means. Yeah, as you may know, there have been 3 vaccines around. One is called Pfizer, one is called Moderna, and there was another vaccine which we don't use much anymore called J&J or Johnson & Johnson. Now, Johnson & Johnson was a one-shot deal. The Pfizer and the Moderna were originally 2 shots, as you may recall, and a booster, right? So fully vaccinated, we now define people that have the 2 vaccines plus the booster. Okay, before that, it was just the 2 vaccines. So what I'm seeing in the hospital, or what we're seeing in the hospital, is the majority, the overwhelming majority that gets admitted for Omicron has not been vaccinated at all. So those are not people that missed the booster. Those are people that did not get vaccinated at all. There is some people that show up in a hospital because, despite the fact that they have been vaccinated, the majority of them has not gotten a booster. The ones that have gotten a booster usually tend to be immune compromised or have at least some risk factors for disease and do very well, meaning they have a very short hospital stay. The patients that are admitted to the ICU, which is the more interesting part, right? Those are the people that need much more care. Almost invariably have not been vaccinated at all.
Were you guys able to hear that okay? Okay. Yeah, we have one member from our audience that has another question, and I'll try to reiterate it if you aren't able to hear.
As a preventive, are there vitamins and stuff that people should take to keep their immune systems up higher and stuff to prevent from getting this?
Did you catch that, Dr. Math?
I did not.
The question from the audience is whether or not, is there any recommendations on any types of vitamins that you can take to help? I mean, I recognize the vaccine is obviously the best to be able to prevent it, but is there anything else that you can do to help build your immune system to assist if maybe in prevention, or in 2, in helping your immune system if you are one that does get COVID?
Right. Unfortunately, there's nothing that boosts your immune system. All you can recommend is you need a healthy diet. But beyond that, any supplementation has not been shown to be of any benefit. There's one exception to that, but that applies not just to COVID or immune system. Because you live in Minnesota, you should probably take a vitamin D supplement, right? And that has simply to do with the fact that you don't have enough sun exposure in the middle of the winter. But otherwise, there is absolutely, has never been, unfortunately, despite the media propagating that and trying to sell it to you, there's never been anything that boosts your immune system ever.
All right, anybody got anything else for the doctor?
I'm sorry?
We're just asking if there's anybody else with any other questions for you, Dr. Math. I don't think there's anyone else that has any questions. I want to thank you and I appreciate your patience, and I apologize that our sound on our end isn't working, but I'm glad that we were able to still make it work. And I want to just thank you, one, for your time and for your continued commitment to helping us get through this, and we appreciate that.
Sure, I appreciate that. If there's anything else I can do, please let me know.
I will do that. Thank you.
You are welcome. Have a good night.
You too. Goodbye. And now I just got to get back to the, yeah, I just got to go back to the other agenda.
All right, is there anyone else here for the open forum? Anyone else for open forum? Anyone else? All right, review and approve council agenda.
Nothing.
Move to approve?
Further discussion? All in favor?
Aye.
Opposed? Passed unanimously. Consent agenda items. Wow. Item A, approve 10/18/21 city council minutes. Item B, approve 11/1/21 city council meeting minutes. Item C, approve new massage enterprise Laura Crastel, doing business as Forever Young 2. Item D, approve 2021 body camera audit. Item E, approve hiring process for full-time police officer. Item F, approve part-time mechanical position. Item G, approve resolution accepting donations to the city. Item H, approve appointing Adam Ritchie to water resource and facility logistics technician position. Item I, approve appointing Adriana Brenny to the city clerk position. Item J, approve authorizing the hiring process for the public works supervisor position. Item K, approve correct pay grade information for public works director. Item L, approve the hiring process for community service officer. And item M, approve firefighter appointments.
I'd like to pull item M.
M,
M for Michael.
the last one, Vic, okay.
I'd like H, I, and J.
I'll move to approve A, B, C, D, E, F, G, K, L.
I'll second.
Further discussion? All in favor?
Aye.
Aye.
Opposed? Passed unanimously. Vic, you were first one to ask, so what do you want for M?
Well, I had a question about that. I'm just wondering if we go through the interview process, if the applicants are talking to their employers about needing time off to come and fight the fire. I never hear that at the meetings when we talk about that. And I'm just curious as if that's part of the discussion process.
Yes.
It is.
When they do that, that's one of the very first questions that they, well, not, it is one of the questions that gets asked during their interview process, yes.
Well, then I'd go ahead and ask to approve item M.
Second.
Further discussion? All in favor?
Aye.
Aye.
Opposed? Passed unanimously. Mike, let's start from the top. H,
On H,
approve appointing Adam Ritchie to water resource and facility logistics technician position.
correct. I think the hiring process on this is creating a new hiring policy, which we've been trained not to start new policies and these types of things. It was a job created for one specific individual. And I hope it doesn't affect our hiring practices in the future, because if you want just one person, we are setting precedents by going ahead and approving this.
All right, anybody else got any comments on that one? Aye, Mike, how about, let's do three of them in a row then.
I guess the only thing that I could say is that the job description was created and approved by the council. The hiring process that we used is consistent with what we've done, where we advertise that particular person internally. We had one candidate that applied, and typically when we have one candidate that applies for a position, we don't do any further interviewing at the council level. That is consistent with every other process that we've done internally. That's what we did with with both of those two positions. That's what we did. So that's similar to what we did then when we came back with the finance director position too. I mean, granted, we went outside, but we went internally. So the process is consistent
And
with how we've handled it.
And that was kind of fitted for that person as well.
Yes.
So I'll move to approve item H.
All right, is there a second?
Second.
Further discussion? All in favor?
Aye.
Opposed?
You.
4-1. Item I, Mike, approve
The only
appointing.
question I have on this for Adrian, to city clerk position is, in the second paragraph, do we have to approve the hiring process to replace her as a city council?
Yes.
Uh,
Yeah, we authorize you to do that.
Approve the hiring process along with putting her in her new position?
Yes. I put it all together because it's kind of one and the same. I could have done them as two separate ones, I guess. I just chose
That
to
will
put
be
it
an
as one.
internal,
It'll go internally
I
first.
understand that.
Yep.
I mean, I know what the
Yep.
process is
Yep.
for that,
Okay.
so. I
So-
just want to make sure that we approve the hiring process.
Oh, I see what you're saying.
I don't know that.
When you look at the language that's written underneath the consent agenda, you're right, Mike. It just is appointing Adriana Brandy to the city clerk position. And then in the background information, it is to also authorize that hiring. So that part got left out. So yes, it would also include authorizing starting the hiring process for her position. So yeah.
So that should be
Yep.
added to that?
Yeah,
the word?
yep. Thanks for catching that. Yep.
Okay, I move to approve J then.
aye,
Aye.
aye,
I'll second
aye.
I'll second.
Further
Ken
discussion?
second.
All in favor?
Aye.
Opposed? Passed unanimously. J, approve authorizing the hiring process for the public works supervisor position.
No, once again, I don't know, I'm not trying to grandstand, but this supervisor permission, I know we talked about several times before. And what we always heard was we need more workers. But now we're hiring more supervisors to replace a working position. I just am not convinced, and especially with our previous what would you want to call it, suggested that they kind of work together for a while to see if they can make it work, as the two supervisors out there improve their working plan. You know, I think we need to hire more workers. I think that's the major problem. Another supervisor, I don't know that that's gonna help the problem. You're gonna have 3 supervisors out there for, I don't know, what is it, 15, 18 people? Something like that. So I don't believe we need it at this time. We believe we need to hire some workers to get the work done.
All right, anybody got any comments? I need a motion to approve or deny.
Really? I'll move to approve.
I'll second.
Further discussion? All in favor?
Aye.
Opposed?
Yeah.
4-1. All right, thank you. Regular agenda, item A, rezoning parcel vicinity of County Road 137 and 28th Avenue South, R1 to R2.
See if I can get this tuned in right. Is this okay? Hear me okay?
Good to me.
Okay. This request was submitted by Bob and Helen Trisco. This is a rezoning of their property. It's not addressed as it's undeveloped, but vicinity of County Road 137 and 7th Street South, 137, 28th Avenue South. what they're looking to do is they've been considering options for development of that property. You may recall they came through with a preliminary plat last year. That was never finalized to final plat because they've been kind of weighing options. But financially, it becomes more economically viable if they have the flexibility that comes with the R2. That would allow, in addition to the single-family type homes, traditional ones, the additional flexibility of townhome, twin home, duplex, and patio home district. So that's something I felt was logical and sound for that area. Makes sense given some of the pull of the senior population to our area, especially that tends to gravitate towards the patio home, twin home type option. I'm supportive of that request, and the Planning Commission was as well. I would note one little edit. The legal description in the packet in the resolution is correct, but the general location map that shows just the area of the property bounded by a red line, the triangular portion that is on that page that's bisected by Old County Road 137, that's not actually part of the property. That's part of a separate parcel. I just wanted to make sure that that's on the record, but otherwise, the legal description, everything is correct.
Okay.
So I would recommend approval of that, of this request. We will probably see additional plans at some point. What you have before you is a concept plan for the breakdown of the single family versus townhome versus patio homes. Potentially, we may see some sort of a plan unit development request in the future, depending on how the lot sizes shake out, some of those sorts of things. But I'll continue to work on that with the applicants, and we will likely see a submittal sometime in the near term, I would expect.
All right, council?
I just have a question. We've talked about available water supplies for development and stuff. Do we have adequate water supplies to provide water and things for this development? We've talked about that, and I still haven't gotten an answer
Yeah.
to that.
Bill's got his thumb up. So.
In the location of this, there is water along County Road 137.
I understand that,
Yeah.
but we.
But he's
my
talking
question
about,
was
I
whether
think
we
he's
had
talking
enough
about
water
storage.
to provide
Got
a
it.
new
Yep,
development.
I'll defer to Bill. Bill can come on up. And,
We have the capacity
And
for that.
Dave Blamo, I believe, is still on the line as well if he wishes to comment.
Yeah, to answer your question, Vic, for this development, yes, we have adequate water supply and sewer capacity to handle this project.
Okay,
How
that's what I
about
was.
going to the south of that project once this gets?
That's
in
what
there?
that's what we're working on right now with that water comp plan, to determine if we can go any further south of Meadowview Lane, or that basically the south property line of his lot there, so. But right now, we do have water service to that area, and we can service it with no problems.
All right, thank you.
All right, any other questions for Bill or anybody?
For John.
Yes, sir.
In this plan, is the roadways, are they gonna be public roadways, or are they gonna become private as part of this building?
That's to be determined, but typically they would be public roadways. They'd be established and then turned over to the city by the applicants. That's been the traditional approach, but ultimately it would be subject to a development agreement at such time as things would move forward to kind of finalize that. But that's been our expectation, is that they would be public roadways.
I think the only way they'd go private would be like Aspen Springs when they asked to put more lots in a condensed area, so the roads got smaller, then we didn't take them. So that would be up to the Triscos. I mean, they could do that. They could probably ask us for smaller lot sizes or more houses, more condensed and smaller roads, but then it would be a private road.
Yeah, and those are things that could still be ironed out as things would progress, that typically the platting and rezoning of a concept plan like this would be the first stage in that. So very possible that there could be such a request as that down the road, so to speak.
Is it also gonna be more of a privately owned home type, or is there gonna be an association that would be formed? This particular development?
That would be at the discretion of the applicants. I don't have any information on that. I'm not sure if they do at this time. There's really nothing that precludes either way, that they certainly could have an association. The city doesn't necessarily mandate that, but if they do, we in our ordinance, we request that we have a copy of their bylaws and things on file and their proposed association arrangement, just so we have that on hand. But it would be up to them whether they wanted to pursue that or not.
And last question is, I don't see any age requirements either required for this particular, because particularly, patio homes and condos, those types of things are related to maybe our older population.
That's traditionally, that's usually the way they lean more towards. It's not necessarily a requirement, but again, it would be up to the applicants to see which way they want to do it. If they did want to restrict it to age X and above as part of their association, we would ask for that information at the time of their submittal.
Would it have to come back to us for approval?
Yeah.
Yeah, it'll have to come back in some way, shape, or form, either at a minimum through the a replatting to adjust the lot. The preliminary plat was never filed by the final platting process. It just kind of stopped while they kind of weighed their option as the market continued to shift. So that's what led to this rezoning request. So after this, we would at least at a minimum see a revised preliminary plat and a final plat. Potentially a planned unit development as their lots may change a little bit from what you see here. That's not uncommon. Sometimes that they can shift a little bit from the concepts. The concept isn't necessarily set to be set in stone. It's just to give an idea of what we'd be looking at. So we expect it to be substantially similar to the concepts in front of you, but not necessarily exactly the same.
All right. All right, any other questions? Otherwise, I need a motion to approve or deny.
I'll move to
Motion to
approve the
approve.
rezoning,
Second?
the resolution to rezone.
Yep. Further discussion? All in favor?
Aye.
Opposed? You got it, Mr. Driscoll. There you go.
Kind of cold to put a shovel in the ground tomorrow, though, isn't it yet?
Item B,
The developers couldn't afford to come out on it. So that's why we had to reshift it so that it makes it more of a moneymaker for the developers.
all right, item B, variance, increase maximum building height from 45 to 55 feet in an I-1 light industrial district, St. Cloud storage.
Yeah, Mayor Miller, council members, this is from St. Cloud Cold Storage. Just for reference, St. Cloud Cold Storage sold to a different owner in the past year and a half or two. As they've been looking at expansion options, they found that both their existing footprint of their buildings and the stormwater requirements that they'd be required to meet are pretty severely hampering the option for expansion on the property. So one of the things that they're looking at, and that's driving the request for the variance, would be to go up rather than out. This would apply to all the buildings on the property. They're requesting to go up to 55 feet maximum versus the 3 stories or 45 feet under the code. They're not necessarily sure that they would go all the way to 55 feet, but are requesting that for a little bit of wiggle room as they would evaluate the options. They're trying to maximize efficiency of the use of the storage space and accommodate installation of a new racking system that's more of a industry standard now, from what I understand. They've indicated these would be necessary to improve the facility to accommodate these new and changing business practices. I think we have all experienced the supply chain issues and the movement of goods in and out, and this is one of the aspects that's kind of driving this for them as well. In staff's opinion, I do believe that they've reached the practical difficulty justification for this, and I don't believe it would be detrimental to the surrounding properties. Discussion at the Planning Commission actually indicated that we had a couple members of the more senior members of the Planning Commission that believe the height limitation that we have in place of the 45-foot, 3-story, whichever, was a kind of a historic holdover from when a ladder truck could only reach that high. And I can tell you, typically, most industrial areas do not have a maximum building height. That's where you'd get your more, especially for larger uses, something like an ADM or some sort of a more intensive plant type use. typically they're not bound by a maximum building height, so might be something now that we have those capabilities via our fire department to reach those adequately. Might not be a bad idea to consider that somewhere down the road to touch that up to prevent any similar requests. But Planning Commission just brought that up kind of as a side note. They did review the request and they recommended approval at their December meeting. We did not have any concerns or input from the public as part of the hearing process. So I would recommend adoption and approval of the resolution as submitted.
Right.
John, I got a quick question. You talked about stormwater retention hindering these types of businesses that are maybe a little landlocked. Is there any way that we could waive that stormwater, or is it state directed, I believe?
It's state directive. It typically only goes one way, and it tends to be more stringent over time. The pond that's there, we actually had sat down. It was under John Halter's tenure, but we sat down with I think it was still the previous owners or someone representing them a couple years ago when they were weighing options for expansion of the facility when it was still owned by the previous owner, and there wasn't really much to do aside from potentially go up, just with the little bit of pond there kind of meeting their needs, and that would even have to be upsized pretty substantially, and the upsizing of the pond didn't necessarily justify the expansion. It didn't really become worth it at that point, at least when those owners were considering it. It's not something we have I don't believe, I'd have to defer to our city engineer, but I don't believe there's any way around or waive the stormwater requirements. This one is a particular interest just because it's
state mandates that cost people a lot of money when they want to move.
Yeah, I don't disagree. This one's a little bit unique in that it was built out so heavily too. It's about at the max for ground coverage with their latest building they did a couple years ago. So
the ground coverage is
the ground coverage and the stormwater, they're pretty much at their limit for footprint, so to speak.
If I can just add, yes, the state is mandating it, but it comes from the federal government through the Safe Drinking Water Act. So this is all a trickle down from the federal government on environment. So federal government mandates the states to adopt a program for that. And then that even trickles down even into the Sauk River Watershed District. So they have a lot of say in this too. So there's nothing we can do about it. This is what we're trying to do to protect our waters. And it's working. But yes, you're right, Mike. It does take properties like this and landlocks them. So their only choice is to buy more land to do that, or in this case, they're trying to, they say they can go up and do it that way. But yeah, it's mandated by the federal government down to the states.
And Dave has joined us virtually, and unfortunately we can't hear him either, but he's chatting with me and basically very consistent with what Bill is saying as well.
All right, anything else? Need a motion then to approve or deny the resolution.
Move to approve the resolution.
I'll second.
Further discussion?
I would just add that the new owners have been very pleasant to work with.
Good.
All right.
All in favor?
Aye.
Aye.
Opposed? Passes unanimously. All right, approve bills.
Move to pay the bills.
I'll second.
Further discussion? All in favor?
Aye.
Opposed? I was just reading. Passes unanimously. All right, public inputs or summary.
I think we need that.
No, I don't think so.
Right.
Administrative update, you got anything?
I can't think of anything off the top of my head. Legislative session will begin the end of this month, hopefully. That'll continue to stay on track if everything goes according to plan. And just working with them on our phase 2 of the ledge bonding request.
Our next council meeting will be the first Monday.
Yes, in the
February.
7th
Should be
of February.
7th.
Yep. Yep, so you get a little break.
Bill, you got anything? Chief? No, sir. Dave? Dave. I was looking over there and looking over there. You, Gordon Junior. Paul, do you have anything? Do you have anything, Paul? All right, then we are adjourned at 7:15.